This is my third presentation. Now the topic is Mogamulizumab in HTLV1 associated myelopathy. The definition: Mogamulizumab is a monoclonal antibody that targets the CC chemokine receptor 4, a protein present on the surface of some T cells, specialized immune system cells, endothelial cells, and nerve cells.
The chemokines are a group of molecules that are expressed by many T cells, as well as in the microenvironment in many of our T and B cell malignancies. And to date, we have one monoclonal antibody that targets a chemokine, and that's the antibody directed against CCR4. So we are interested in exploring further whether there's a role for other chemokine-directed therapy in lymphoma. We are targeting a specific chemokine with a small molecule to see whether or not we can either inhibit the growth directly of tumor cells or affect the microenvironment in such a way that we can halt the growth of the tumor cells, perhaps in combination with other therapies. So this is a new area to try to develop the use of small molecules as potential targeting agents against chemokines in the microenvironment. So in addition to affecting directly the tumor cells, we may also affect the migration and the propensity for metastases with these small molecules.
Well, application in medicine. The anti-CCR8 antibody Mogamulizumab appeared to selectively target and reduce the number of HTLV1 infected cells and no indicator of HAM-TCR prognosis.
Mogamulizumab is a humanized antibody that targets chemokine receptor 4. And chemokine receptor 4 is responsible for T cell recognition of the immune response. And we don't know its specific action in T cell malignancies, but we think there's an on-target effect. So a number of T cells express CCR4, and when mogamulizumab targets it, it is missing a fucose on its FC region, a constant region in the antibody, and that allows for enhanced antibody-dependent cellular cytotoxicity. So there's a direct on-target effect. But then CCR4 is also present on normal T helper cells, T helper 2 cells, T regulatory cells, and we're investigating this. In fact, here at ASCO, there have been a number of abstracts looking at mogamulizumab in solid tumors that don't perhaps express CCR4, and there's probably a role in immunotherapy for its mechanism.
Issue played in Ecuador. The hospital ES made a study in 2007 where they concluded the existence of chronic HTLV1 associated myelopathy in Ecuador with an endemic focus in Esmeraldas. Pros and cons. Pros, it decreased the number of HTLV1 infected cells and no adverse events at above grade were noted. And cons, there are cases of lymphopenia and increase in the incidence of herpes infection, which suggests that immune deficiency may be of concern.
What is myelopathy? Myelopathy refers to any condition that affects the spinal cord. The spinal cord is the delicate extension of the brain that hangs in the spine from the neck or cervical spine through the mid-back or thoracic spine to the top of the low back or lumbar spine. It is protected by the spinal vertebrae consisting of hard bone and connecting ligaments. There are conditions in which the spinal cord may become pinched and cause problems. These include weakness and numbness, or even poor coordination, such as clumsiness in the hands or imbalance while walking. This may also affect the function of the bowels and bladder. Surgical conditions that cause myelopathy include herniated discs in the neck and mid-back, as well as arthritic conditions such as spinal stenosis or spondylosis, where the spinal cord is compressed. The The symptoms may come on suddenly or more typically slowly, so as to be hard to recognize until they become more advanced. And since pain...
Conclusion. Nowadays, FDA has now approved the use of this medication especially for patients with mycosis fungoide or Sézary syndrome. Information. I'm Giancarlo Morris Zambrano, medicine student. I study in US Universidad Católica Santiago Guayaquil. My Facebook Giancarlo Mori. My Twitter. Find me on Giancarlo Morris Z. I live in Guayaquil, Ecuador. Thank you.